Dr. Rebecca Berger, welcome to Shrink Wrap Radio.
Thanks so much for having me on the podcast. I'm really excited to be here today talking about dialectical behavior therapy and how to use those skills in regards to coping with the pandemic and all the stressful situations that are currently happening for everyone.
Yeah, well, I'm so glad to have you here. I actually went online and did a search. I was looking for some expert that I could invite on to, talk about DBT and the role of helping people cope during this pandemic. And I found an article that you had written about using remind me what Dialectical Behavior Therapy. Use the initials so much I forget what it stands for. DBT,
exactly,
Dialectical Behavior Therapy. And you wrote an article about personally using it to cope with your own anxiety during the pandemic, because who isn't somewhat anxious or more?
Yeah.
So I have to applaud your courage to come out in such a personally revealing way. As a therapist yourself, did you have any fears or personal concerns about doing that?
I've had a few people who read it ask me that as well. And I have to say not particularly. And I think that's for a few reasons. The first is I didn't feel like it was particularly revealing. I think regardless of the fact that I'm, a clinical psychologist, we're all a person struggling during the pandemic.
Right.
So having anxiety and fear around that is just a normal human response to an abnormal situation.
Yeah.
And I think DBT has become more popular in terms of treatment and pop culture. And, I wanted to make these skills accessible to everyone. And DBT really influences or emphasizes the idea of radical genuineness, right? Being open and sincere and transparent as a therapy tool.
Yeah.
So it's very consistent with DBT and also my beliefs as a provider. I actually wrote my dissertation on therapist self-disclosure. So it's a topic I'm pretty comfortable with. Yeah.
Yeah, me too. It's how I've always tried to run my approach to psychology and therapy as much as possible. It's always, I think it's close to my nature, I think, so that it's not a stretch for me to do that. And of course, one has to keep in mind to make sure in a therapy context to make sure that it's relevant and that we're not overdoing it and taking the spotlight off of the patient where it belongs and swinging it to ourselves. And so give us a little background on DBT.
Sure. Yeah. So DBT, as I think it's commonly referred to now, stands for Dialectical Behavior Therapy. And Dialectical Behavior Therapy, or DBT, falls under the larger umbrella of cognitive behavioral therapies. Mm-hmm. So looking at our thoughts, our emotions, our behaviors, our urges, and how those interact to, impact our life. And so dialectical behavior therapy was originally created by Marshall Linehan, as I'm sure some people are familiar, for a diagnosis of borderline personality disorder. People who are really struggling with perhaps life-threatening behaviors, intense emotions, risky behaviors. But, it's come such a long way. We've realized that these skills, which are really practical, can help with a variety of things. Yes, clinical anxiety, clinical depression, other diagnoses, but also just managing life stress, intense emotions day to day. So it's an evidence-based treatment, and it really looks at how to use practical skills to help create a meaningful and vital life. And there's four main components of DBT. The first is mindfulness, so sort of becoming aware of your thoughts and feelings, right? It's really hard to intervene if you're not first noticing and being aware. Emotion regulation, which is perhaps you're experiencing, some intense emotion or ups and downs of emotion, skills you can use to better regulate that. Distress tolerance, so that's when, your emotions are maybe like a 7, 8, 9, 10 out of 10. We call that the red zone. Everything's feeling really hot. And if you're afraid that if you respond, you're going to make the situation worse. So skills that may not improve the situation, but help you safely manage that red zone. And then interpersonal effectiveness, which is how to get your needs and other people's needs better met in the context of relationships. And that also really stresses validating others, validating yourself, making sense of your own experience.
Yeah, I don't know if you mentioned that she developed it originally to work with borderline personality
Mhm,
disorder, or BPD, another
mhm.
three initials, and which had been up to that point regarded as pretty intransigent.
Yes.
You know that that personality is so deeply rooted that how are you going to change a lifelong personality?
Mhm.
And what do you think it is about what she did that sort of shifted that perception?
Yeah. Um, so I will say, I think one of the most meaningful things is approaching it from a stance of validation, right? So
Mhm.
I think for clinicians or family members or loved ones of someone who may have a diagnosis of BPD, or not formally but have traits or they suspect that, it feels really scary. It feels really overwhelming. And when people are approaching something from a stance of being overwhelmed or finding something scary, I think it makes accessing the understanding of those people more difficult. And Marsha Linehan really emphasized the importance of validation, trying to figure out why these behaviors make sense from that person's perspective.
Uh-huh.
And we know that there are biological, psychological, environmental reasons that people develop those behaviors and symptoms as a way of coping with their world. So if we can make sense and look at it from empathy and validation, then we can take a step back and understand why. And once we understand the why or a function of a behavior, then we can come up with skills to really intervene and give someone alternatives to the function of that behavior.
Yeah.
And I think the emphasis also on, many people who are diagnosed with BPD may struggle with life-threatening behaviors, and that can be really scary for them as well as practitioners. And Marsha Linehan said, hey, it's not our job to prevent them from engaging in these things, right? That's too much pressure. We're going to get stuck and tripped up doing that. It's our job to help them create a life worth living, right? And that's something we
When
can
you
all
say,
get on
I would
board
just
with
want
and
to back up.
collaborate.
When you say threatening behaviors, you're talking about self-threat, suicidality, cutting, burning, things like that, right?
Yeah, that could
Or
be
bad decisions.
self-harm. Yeah, that
Yeah.
could be self-harm, such as cutting or burning. That could be suicidality. That could also be behaviors such as substance use or engaging in other impulsive behaviors that could lead to life-threatening behavior. For instance, people who struggle perhaps with eating disorders, once that gets to a certain level, that could become life-threatening, right?
Yeah.
And so it really helped develop practical skills to manage those things and help people say, this is what's important to me. These are my values. How do I build a life consistent with those values versus only trying to get rid of my symptoms? Because getting rid of your symptoms doesn't inherently build a life worth living.
Yeah, I love that you use the word skills, because that's another thing I was thinking about. It is it's a skills based approach,
Yes, very much so.
non-blaming. You know, that just I think it's a bad diagnostic term. You know, borderline personality disorder
Yep.
sounds so heavy. It sounds like a borderline of what? Are you on the borderline of just going absolutely bonkers?
Yes,
Uh,
it's a judgmental diagnostic term in and of itself. And so I
yeah.
will say that for practitioners who practice DBT, we really, while of course sometimes for insurance and other reasons we need to code diagnoses, we really try to look more so at the symptoms, right? So there's emotional vulnerabilities. People may experience intense emotional distress. They may be more sensitive to emotion, right? Like they're super sensitive when it comes to emotion, which
Right.
makes sense given their life experience. And I think that's a much more validating way at looking at people's holistic experience.
Yeah. Yeah, I agree. And so in your wonderful article, and I'll put a link to your article in the show notes so that people can see it. It's really, I think you just kind of put it out there without expecting much of a reaction, but you got a lot of reaction to it, right?
Yeah, I got a lot of positive reaction. I got a lot of support, and it wasn't really expected. I was hoping to reach people who were struggling with the pandemic like I was, and my clients were all over the place in terms of geography at that point, and just trying to pull everyone together with a similar sentiment. But it got some positive feedback, and I was really happy about that.
Yeah. Also, I did interview Marsha Linehan years ago in the early days of my podcasting career. And I'll put a link to that as well in the show notes so that anybody who's watching this can look for those at shrinkwrapradio.com, where
She
your
certainly
interview.
describes it best.
Pardon?
I said she certainly describes it best.
Yeah. Well, I think I got her early on. I think it evolved a lot, after a lot after my interview. Not that my interview helped it evolve at all.
Who knows?
And so you identify some, I guess, DBT techniques or strategies in your article in a very personal way, talking about as you move through your day, things that might come up. And so I wanted to call out some of those strategies or skills that you talk about. So one of them is called opposite action. What does that mean?
Yes. So opposite action is an emotion regulation skill. And opposite action is, sort of what it sounds like. It's doing the opposite of what our emotion is telling us to do. If engaging what our emotion is telling us to do doesn't make a lot of sense and could make things worse, right? So I'll give you a simple example that I use when I'm explaining it. So I live in New York City, and despite the fact that things are a little strange here right now, right?
Yeah.
We can imagine what a normal day in New York City looks like: midtown, bustling, busy. Now, if I was standing on the street corner and it was a stop sign and I had the urge to walk anyway, right, and I jumped back in fear, that would make sense. That's protective, right? I should listen to what my emotion is telling me in that moment. If, on the other hand, it's the middle of the night, nobody's around, there's nobody coming down the street, I have a walk sign, and I go to walk, and I get scared again and I jump back, right? I listen to that fear. That doesn't make sense. It doesn't fit the facts. So opposite action is noticing, is this emotion urge fitting the facts? And if it's not, let me do the opposite. It is engaging fully in the opposite behavior in order to prompt an opposite emotion.
Okay. And that touches on another one that you mentioned, checking the facts.
Mm-hmm. Mm-hmm.
So tell us more
I use this skill a lot.
Yeah.
So checking the facts, again, aptly named, right? However, the tricky part is that human beings often make the mistake of assuming things that are facts are not facts, right? If, for instance, I had the thought that I had bright pink hair, right, which would be cool, I don't, in fact, have bright pink hair. That is just a thought that I am having, right? That is content my mind is creating. And so sometimes our thoughts are facts and sometimes they're not, right? So we want to check the facts. If I said it's sunny outside today, that would be a fact, right?
Yeah.
And so basing our behavior on what our facts are. I also really want to emphasize that our emotions are always facts. I don't want people to sit there and think, well, should I not trust my emotion? Our emotions are subsequent to our thoughts, right? So our emotion is always valid. The thought that got us there isn't always valid. And in checking the facts, we can then proceed accordingly in a more effective way that might be more helpful in whatever situation we're in.
Yeah, that makes sense. And earlier you had mentioned mindfulness, and I think that's so key because it's so easy in our automaticity of daily life to just be moving through it and not really noticing our thoughts, our thoughts and emotions and so on. Just kind of so say something more about that, because I always think it's a very important skill. And the word is so current right now.
Yes, it's a hot word.
It's almost overused,
Yes.
I've jokingly said here, semi-jokingly made the observation that I think we're in a mindfulness bubble, because any book on self-help has got to have probably a whole chapter on mindfulness these days.
Yeah, no, I mean, it's the hot it's the buzzword right now in psychology and practice. And at the same time, I think it is a buzzword for a reason, maybe not 100% of the time.
Yeah.
But, mindfulness is the core skill in DBT. We teach mindfulness skills in between all of the other skills recurrently because it's so important, right? And you brought up being automatic, right? We
Yeah.
all go through our days sort of on autopilot. And
Right.
mindfulness is the skill that interrupts that. It's paying attention on purpose, right? And it's challenging because it's not just paying attention. When we notice something, we don't want to control it. We don't want to say, go away or stay here longer, right? It's just noticing as it comes up and passes. It's an
Mhm.
intentional way of paying attention. And the goal is to reduce our overall suffering over time and to increase some control we have over our thoughts and behaviors and our emotions. That's inside our body, outside our body, but we can't choose behaviors or reactions that make sense unless we're first noticing and paying attention. So it's
Right.
just
You
a
have to be aware of it.
purposeful, compassionate way of paying attention to our experience.
Yeah, the compassionate is an important part of it too. You mentioned how Marsha Linehan's approach was to be non-judgmental. And
Mhm.
so in that same way as we're observing our thoughts, it's watching them go by, but without judgment,
Yes.
um, without condemnation or, oh, I shouldn't be thinking about that, or,
Yes. And that's
whatever.
really
Just
hard.
noticing.
Mindfulness is a muscle that needs frequent working out.
Yeah, yeah.
um, and it's just not something we're prone to do, especially, as we're people on our phones, we're watching TV, we're doing this, we're doing that. We're never doing just one thing and letting it be as it is.
Yeah, at least these days, that's
Yeah.
very, very rare. Now, you use an acronym, uh,
Mhm.
the word please, PLEASE. Can you
Yes.
take us through what each of those letters stands for?
Yes, absolutely. So, what I want to sort of emphasize with the please skills is that we have such a strong brain body connection, right? What we experience emotionally, we often experience physically, right? I was a little nervous today, so I had butterflies in my stomach, right? That connection. And so please skills, and I'll go through the acronym, please skills are meant to help us have some control over what's happening in our body as a way of helping what's happening in our mind if,
Mm,
trying to solve the thoughts and emotions feels too difficult, because
okay.
that connection is so important. So the PL stands for physical illness, right? So going to the doctor, taking your medications, paying attention when something hurts and responding to that. E stands for eating healthfully and often, right? So eating 3 to 5 meals a day, eating what makes
No
our brain,
problem for me.
as many of us are experiencing in the pandemic, and others are also experiencing sort of the urge to overeat or undereat during the pandemic, right? So it's eating in a way that feels good for our body and our mind, perhaps working with a nutritionist if you need to, but fueling our body. A stands for avoid mood altering substances, right? Or using them wisely. So having 1 glass of wine instead of 4 glasses of wine, right? Substances have a real impact on our mood and our behaviors. So using wisely or avoiding if necessary. S stands for getting enough sleep, which for adults is typically 7 to 9 hours. But when our bodies are under a lot of stress, that could also be more, right? I've talked to a lot of people who are saying, I'm sleeping too much. I'm sleeping 10
Mhm.
hours. Sleeping 10 hours makes sense when we're sort of experiencing so much distress. So that's
Yeah.
okay. And then E, which is exercising regularly. And here we're primarily referring to cardio 2 to 3 times a week, good for heart rate and blood pressure if you can do so, right? Not everyone can do cardio 2 to 3 times a week for a variety of reasons. So doing what your body will allow you to do in terms of physical movement.
Yeah, so all of that sounds very common sense, but I guess people who are particularly vulnerable, maybe people who suffer from BPD or other anxiety disorders, can kind of lose track of taking the sensible care of themselves that we all know we should do.
Yeah, and I think all it takes is one busy or anxious day to forget that we didn't eat breakfast or lunch that day, and then we get to dinner and our blood sugar is low, or to realize the only thing I've had today is a lot of caffeine, right, which is a mood altering substance, and realizing, why do I feel like I'm having a panic attack? Oh, that might be related to my caffeine intake, right?
Oh,
So it's just being, again, mindful of the brain body connection.
okay. There was a quote that I pulled out of the article, a sentence of yours. You said, "I am grateful to DBT for reminding me of dialectics, the concept that we can make space for more than one truth." Talk about, I believe in that. Talk about space for more than one truth.
Yeah, I think this is one of the most important DBT concepts, but also one of the most challenging. I think it is within our human nature to feel really pulled all one way or all another.
Mhm.
Black or white thinking, all or nothing thinking, as we refer to it. But that doesn't really allow room for life's complexities, nuances, the gray area, right? And so, a really simple dialectic, as an example, might be, I can be strong and vulnerable, right? Strength
Uh-huh.
does not equal being defended, or vulnerability does not equal weakness, right? I can be strong and I can be vulnerable.
Good
So it's
example.
allowing room for those complexities and holding more than one truth at one time.
Yeah, yeah, yeah. I think that we've also, in some ways, referred to that over the years as being psychologically minded, which is realizing that there's a whole complexity within us. And,
Absolutely. And,
a
cognitive
real,
flexibility is linked to so much increased well-being. It's a really important concept.
yeah, yeah, yeah. I've been reading about that. Being wise-minded is another
Mhm.
tool that you point to.
Yeah,
So
wise-mindedness is
how
one
do
of
you
my
do
favorite
that? I
skills.
mean, how do you know if you have any wisdom at all? What does that mean?
Well, we all have an inherent wisdom, right? We all understand our experience more than, or in different ways than other people can, right? Humans, like being dialectic, this is similar to dialectics, tend to get pulled in one direction or another, right? And the idea of wise-mindedness is that we have three states of mind. So we have emotion mind, which is the first, right? So that might be when we're ruled by our feelings and our urges, and we're considering little else. We're not considering logic or practicality, right? And then we have the second state of mind, which is reasonable mind. So we're responding to things only with logic or pragmatics or reason, while foregoing what our emotions are trying to tell us, right? Wise mind is that middle path between emotion mind and reasonable mind. We're taking into account our emotions and our urges while also considering logic and reason, right? So in this case, wisdom, or being wise-minded, is taking to account both of those other factors as well, to make the most reasonable, taking the most reasonable steps forward that we can, a middle path.
Nice, nice. Well explained. Um, Another skill that's important is self-soothing. It's kind of self-explanatory. What what kind of self-soothing do you use when you're under stress?
So self-soothing in this concept is using our five senses, or six senses if you want to consider movement. So responding to sort of intense distress with our senses. So that could be having, a cup of tea, which I often do. Mine is mint tea, as self-soothing. Or if I wasn't living in a New York City apartment, I used to have a bathtub, so self-soothing would include taking a bubble bath, for anyone listening who can access that.
Yeah,
um, it might be stretching. It might be using essential oils like mint or lavender. I have an oil diffuser, so that's another one that I use. But it's trying to incorporate our senses when we're feeling really overwhelmed.
yeah. You could also consider including touch. I mean, it's possible to give yourself a hug,
Hmm.
to accept that, or to imagine, if you don't have somebody to touch you, to imagine to actually touch yourself in a caring, compassionate way, whether
Yes,
that's
absolutely.
massaging places on your body or just enjoying the contact with your skin.
Yes, absolutely. And, touch can also include having like a certain fuzzy blanket or a go-to sweatshirt. Something that touches your skin, is cozy, is soothing. Absolutely. Physical
Yeah,
touch is really important if we have that to access.
yeah. Another technique that you advise is to accumulate positive emotions
Mhm.
um, in engaging in pleasant events.
Yeah. Yeah. Therapy is not just about decreasing things that aren't working, right? It's about finding things that do work. And
Mm.
I like to explain this by sort of having people imagine a seesaw, right? So if everything is negative emotion, everything is stressful, that's tipping the seesaw in one direction. And that's a direction that feels pretty heavy handed, right? So we want to balance out that seesaw by accumulating positive emotion, experiencing pleasant events. And we want to do that in the long term. Maybe that's building a new skill, starting a new job. We also want to do that in the short term, right? Like engaging in something every day that makes you laugh or smile. Could take taking a brief walk. It could be just trying something you haven't tried before. But the idea is like we have to balance that seesaw or life doesn't feel meaningful. So trying to be use small and creative things to accumulate positive emotion.
Yeah, that brings to mind a period in my life where I think I was doing something really good for myself. I was working in market research, leading focus groups for people to talk about the products that they use and so on for commercial clients. That involved traveling to different cities across the country. And traveling, is even more burdensome today, if even at all possible. But at the time,
Mhm.
it was a big deal having to go to the airport, find parking, all of that hassle of travel and traveling to other cities. And so I would build in to make sure that I would have some fun on the trip, that it wasn't just work. And the
Yes.
way I would do that is go to comedy clubs. That was sort of during a time when comedy was making a big comeback. And I'd just go to a comedy club, in a new city and laugh my head off and just get flooded with good emotion.
Exactly. Yeah, that's a great example.
Yeah.
I'd love to be able to go to a comedy club right now. I suppose the circumstances don't allow it, but it's a really great example.
Yeah, right, right. Fortunately, we have Netflix that's got
Yeah.
the comedians doing their comedy club routines there.
Yes. Thank
Uh,
goodness for Netflix.
yeah, thank goodness. I love the Jerry Seinfeld special that they put up recently.
Yeah, the new one. I haven't seen it
Yeah.
yet. I heard it's
Oh,
good.
it's delightful. It's classic Seinfeld. um, yeah, it's he makes a lot of good points. It's funny, you'll listen to a comedian like Jerry Seinfeld and you just go, yes, yes, yes. And then I can't remember it afterwards.
Feels good in the moment though, right?
Yeah, yeah. You also talk about developing distress tolerance skills,
Mhm.
and you talk about breathing. Talk to us about that.
Sure. Yeah. So, distress tolerance skills, as I mentioned before, are sort of crisis survival skills, right? So that's when our emotions are in the red zone. So, like, if our emotions are on a 0 to 10 scale, the red zone might be like a 7 through 10, right? And we might not be able to solve the problem, but we can at least try to get through the moment safely in a way that's not going to make anything worse. And so, distress tolerance skills are the module of skills that fall under that category. One of those is paced breathing, which is a form of deep breathing. We want to try to help lower blood pressure and heart rate, excuse me, right? Because that helps develop a sense of calm and lowers intense emotion. So the way to engage in paced breathing is to breathe in, inhale slowly for maybe 4 to 6 seconds, whatever your breath allows for, to hold that for a second or two, and then to exhale more slowly. So maybe 5 to 7 breaths. It could be longer or shorter depending on the person. And you want to repeat that for a few minutes. So in for 4, out for 6. And that helps lower your heart rate and blood pressure, so your physiological arousal, allowing you to feel an increased sense of calm.
Yeah, there's so much behind that now, so much backing for it, a lot of scientific support for it, uh, having actual physiological, measurable physiological effects, centuries of yoga practice
Mhm.
behind it, and so on. And heard an interview on uh, with Terry Gross, and someone who had written a book that was
Mhm.
all about breathing and the importance of breathing. Well, we
Yep.
all know that breathing is important, but of being able to control your state of mind through breathing.
Yeah, because when our emotion gets that high, and I'm sure we've all experienced a time when an emotion has gotten so high, we can't really use our like higher executive functioning tasks then, right? It might be hard to engage in a helpful conversation or to problem solve. First,
Yeah,
we have to lower our arousal before we can do those things. So
yeah.
it really is so crucial.
Well, circling back to the beginning, there's one more that I think you mentioned early on, which is in your article is described as radical acceptance.
Mhm. Yeah. Radical acceptance, in my opinion, is the most helpful and also the hardest skill in
Yeah,
DBT. And it's one we have to return to practicing over and over and over and over, right? And so radical acceptance, the idea behind that is like if we're alive, if you're human, right, we're going to feel pain. Pain is an unavoidable part of life, unfortunately. People try to develop all sorts of ways around it, and that can lead to, disastrous other consequences, right? Because we can't avoid pain. It's just part of life.
right.
We can, however, help to mitigate our suffering, right? Pain is the experience of it. Suffering is what we do with that, right? So if I'm swimming and I get pulled out by the tide and I try to fight the tide, that increases my likelihood of drowning. If I relax and say, oh, this sucks, but I'm going to let the tide take me, it's likely going to bring me back, right? So when we are fighting against our pain, we unintentionally make it worse. So the concept behind radical acceptance is that we have to practice ways of allowing our pain to be there without making it worse. And there's a lot of different ways to practice this, but it really, most importantly, requires the willingness to let pain be there. And I think that's the hardest part and also the most helpful when we are willing to do so.
Okay. Now, are you doing distant practice, doing meeting with clients on Zoom and such?
Yes, I am. I'm very lucky in that, the number of people I'm seeing and has certainly not slowed down. I'm seeing all my clients over a video session.
Wow, that's great. And what kinds of reactions have you seen among your own patients during this COVID-19 crisis?
Yeah, I'd say that's variable. I'm a practitioner in New York City, and so we've sort of been the epicenter of what's been happening. So
Yeah.
I can't say that anyone has been spared. Everyone is being impacted in some way. It just depends in what way. So for some people, I've seen them lose loved ones or they've lost their job, and so we're focusing on a lot of radical acceptance, a lot of grieving, a lot of problem solving. Some people are, temporarily at home or in other living environments that may not be the most healthy. So we're working a lot on how to be effective in those interpersonal relationships, how to problem solve, how to self-soothe. So I've seen certainly an increase in anxiety, but I think most interestingly, I've seen so much resilience. I think this has, in
Mhm.
some ways, put things in perspective for some people, and so I think a lot of the people who I've done DBT with can now teach me DBT or their loved ones DBT. They're really using the skills, and I'm seeing a mostly resilience. So yes, an increase in distress, but also an increase in skill use and perspective taking, and which has been really cool. And I use a lot of humor with my clients. They use a lot of humor with me, and that's been really therapeutic for all of us, I have to say.
That's so heartening, and it's also been very heartening to see the resilience in the culture in terms of the videos that people are putting on YouTube, people singing to each other,
Mhm.
um, the resilience of the human spirit. And sometimes in the face of a challenge, it can bring out the best in us, or
I
can
would
bring out,
certainly agree. Humans
can
are
bring out,
amazingly adaptable.
yeah, it can bring out strengths and skills that we didn't even know we had.
Yeah, absolutely. I thoroughly agree with that.
In fact, as we look over the course of our development, we realize that I realize over the course of my development that some of the things that I looked at as most, oh no, this horrible thing that I have to do that I don't want to accept. And then reorienting, and it turns out to be a great growth step. It
Hmm.
triggered growth to have to to dig down in myself and find a way to move, to accept,
Sure.
what's coming into
I
my
mean,
life.
that's our only option, right? I mean, change is constant. And
Yeah.
I actually have a sign in my office that said, all great changes are preceded by chaos, right? And I really believe it. It's really uncomfortable, right? There's a lot of
Mhm.
discomfort prior to those periods of change and growth,
Sure.
and we're capable. Humans are so resilient. It's my favorite thing about the job.
um, I happened across a clip of Lady Gaga that I was very struck by, where she was, and it was right at the beginning, I think, of the crisis, and she was talking about D, DBT of all things, and and talking about mental health and the importance of mental health. And then you mentioned that she'd been you mentioned to me before our interview that she was on the Oprah Visionary series.
Yes.
So that motivated me to go look for that. And I found a nice little video clip that I will also put in our show notes, where, she's talking very passionately about mental health. Uh, Say a bit about your experience of what you saw in that video series with her.
Yeah, absolutely. I love sharing that video series with people. It can feel really validating for clients who, feel really alone, and for people trying to understand what DBT is. Lady Gaga has been very open about her struggles with mental health. She's specifically noted sort of having past trauma and chronic pain from fibromyalgia. And so she's sought DBT treatment for that, both inpatient and outpatient. And she's identified that it's been really helpful for her in regulating both her intense, emotions as well as intense physical pain. And she gives a really compelling, article or a statement about DBT and the way it's helped her, and encouraging other people to seek support for their mental health, trying to destigmatize that.
Yeah, yeah. And she also, in the clip that I pulled out, she was talking about the, the really trying to fight the stigma that's around mental health, seeking out mental health treatment.
Mhm.
And that's why it's so brave and important for somebody with a high profile, and also whose audience are all these young kids, who have all sorts of fears and things that they're struggling with. And she's so validating and putting herself out there. And she also is quite open about medication,
Yeah.
and not just meditation, but medication,
Mhm.
medicines that she says have been very helpful to her.
Yep.
And so she doesn't like throw that out, throw the baby out with the bathwater. She says,
No.
she's kind of saying we've got to use everything that we can that can benefit us, and that she's derived benefit from a variety of sources, including, I remember something about ice. What's the deal about ice? Where does that fit
Yeah.
into the model?
Yeah. So the ICE is part of the distress tolerance skills, and it's another acronym because DBT loves acronyms. And so the overall acronym is TIP, but the T stands for temperature. And I actually didn't know this until I learned DBT, but humans, like mammals, have a dive reflex. So when we dive under cold water, we have to, our heart rate and blood pressure have to slow down to conserve energy, and that can create a calming effect. And so there's two ways for humans to do that. They can either stick their face in a bowl of cold water and hold their breath,
Mhm.
or they can take an ice pack and put it over your eyes. It has to be over your eyes. That's what the research has found. And sort of tip your head over into your lap for about 2 minutes. And that promotes the same sensation. It activates that dive reflex. And so that's what she's referring to when she mentions the ice.
Uh-huh. Okay.
Mhm.
Um, so as we kind of wind down here, do you have any, I think there's been a lot of good advice in what you've said, but to kind of summarize, what would be your advice to our audience during this continuing COVID-19 crisis, both generally and specifically to BPD sufferers?
Sure. So, I mean, first, generally, I'd say that, just like emotions, everything passes or changes, right? And so the changes and the limitations related to the pandemic will also change and pass, right? I don't know what and how that will look like, but inevitably all things change over time, right? And so the confines and limitations we're facing right now will be different. So I think trying to do what you can day to day while balancing that with remaining while remaining future oriented. Humans, as we mentioned before, they're so remarkable and adaptable and resilient. And I think it's important to tap into that when this feels never ending. I also encourage people to tap into their social supports if they have them, if not, to try to access maybe some online support. Humans are really social creatures, even introverted ones. We're not meant to do things, we're not meant to live and suffer on our own. So I think the pandemic has made us feel really isolated. So if you can find ways to engage with others, however that might be, I think that's so important. And specific to people who may worry that they might have BPD or do have a diagnosis of BPD, I think that diagnosis over time has felt really invalidating. And I would say directly to them that, like, your experience makes sense. There are reasons why you're having this experience, and there are evidence-based treatments that can help. One of those is DBT, and to try to follow Lady Gaga's lead and, destigmatize that and to seek treatment if you need it.
Yeah, we're going to follow your lead as well. So, Dr. Rebecca Berger, I really want to thank you for sharing this wisdom and for being my guest today on Shrink Rap Radio.
Thank you so much.